All right. Thank you so much for you guys for tuning in. Welcome to another episode of the Black Surgeons podcast. Today I have Dr. Chrissy Freeman. She's an OB-GYN resident, soon to be an attending in a couple weeks from now. Right now we're in June 2025 recording this. I'm really excited having her just because she went to Emory for medical school and she's now down in California for her residency. And then sounds like she's excited to be back home at Emory again for attending them. So Dr. Freeman, thank you so much for being here. I'm looking forward to talking to you. So to get started, why don't you introduce yourself a little bit, who you are and what you do right now.
Yeah, thanks for having me. So I'm Chrissy Freeman. I'm originally from Memphis, Tennessee. I've spent most of my life on the East Coast and in the South of the country, and then decided to venture out to California for residency training. All of my family is still in Memphis, and so I'm very excited to, move back to Atlanta, which is like my second home now, and just be closer to family and friends and reconnect with everybody that I've been separated from for the last 4 years. I chose to go into OB-GYN because I was inspired by the experiences of so many women around me, women in my family, my friends, who have all had like variable experiences dealing with their women's health issues, whether that's, bleeding from fibroids or having a baby and having complications. So seeing all the struggles that we as Black women deal with regarding women's health, and then especially in pregnancy and childbirth, really inspired me to pursue this as a career. So here I am, as you said, 2 weeks away from graduating residency and moving on to bigger and better things.
I'm super excited for you. I wish I would say the same thing, but I'm still on the struggle bus. But
It's okay. It's okay.
the light is right at the end of the tunnel for all of us. So, tell me a little bit about you growing up. You mentioned a little bit about Memphis, Tennessee. Tell me a little bit about that and upbringing, middle school, high school time. And were you thinking about being a physician during that time, or what were you thinking?
Yeah. So my parents will tell you that I told them I wanted to be a doctor when I was like 4. And like, what 4-year-old actually knows what that means? So it's unclear where exactly I got the idea. But I think it was because I was lucky to have one of the few Black pediatricians in the city of Memphis. There were 2 Black women pediatricians in this practice. Dr. Jones was my pediatrician, and I loved going to the doctor. Like, what little kid likes going to the doctor? Me. I was happy to be there, happy to have her and like get to, like she was my pediatrician from the time I was born until I turned 18 and left to go to college. And so I think just having that visual representation as a child was very important for me and really inspired me to want to do the same thing that she did. I didn't have any doctors in my family growing up. My mom's uncle is married to a physician who's an OB-GYN and who has delivered a lot of the babies in our family. But as far as like my parents and my direct lineage, I am the first. And so it's definitely been challenging, growing up in Memphis. There's not a lot of Black physicians, at least I wasn't connected to them growing up. And so my parents really put in a lot of effort to make sure that, I had all the best educational opportunities available to me. I attended like schools for gifted children where you had to like test and have certain test scores to be able to get into the schools. I was in the honors program in high school and really had the opportunity to go to a really amazing college. I went to WashU in St. Louis, so that was not too far from home. It was great. But that's pretty much kind of my upbringing. I have a really, really big family. And so I think I have over 20 first cousins or something. I don't know. There's a lot of us. But yeah, everybody's still back home. So I'm excited to, like I said, be closer to home, but
Yeah.
not quite home.
So what was the decision of, as far as college goes, where did you want to go, and did you want to choose a place where you feel like, there's some pre-med stuff here going on and, maybe I'll be able to go to medical school after this? What was that decision like from high school to college?
Yeah. Yeah. So when I was in high school, as I mentioned, I was in the honors program, and I had my AP biology teacher, love her to this day, still in contact with her. Her name is Miss Perkins. And I told her that I was planning to go to medical school and I wanted to be a doctor. And when I told her that, she like completely flipped. And she was like, okay, I'm going to be on you. Like, she was watching me all the time, making sure I was like very diligent about my schoolwork and getting things done. And just, she really gave me a lot of needed attention to make sure that I was staying on the right track. And I remember we took the ACT, and after you take the ACT, now all these schools and everything have access to your records. And I started getting emails and invitations from different schools to come visit or to apply for certain scholarship programs. And I remember I got an invitation from WashU. I think it was either the summer, maybe it was like the summer between junior and senior year. And they were inviting me to apply for the John B. Irvin Scholars Program and to come to campus for a visit. I had never heard of this school before. I was like, Washington University in St. Louis. Why is it called Washington University, but it's in St. Louis? It doesn't make any sense. Never heard of the place before, but, looked up WashU online. I was like, oh, this is a really good school. They have a great pre-med program. So I went on the visit. I had a great time, and I ended up applying to WashU early decision and got in, got full tuition, room and board, scholarship. And my primary goal for college was to go where it was free, because I knew that if I wanted to do medical school, I was probably going to have loans in med school, because scholarships to med school exist, but they're rare.
Mm-hmm.
So, my goal was to go where it was free. I could have, stayed in state or gone other places, but may have had to pay a little bit. And so once I got that full tuition scholarship, I said, oh, well, that's where I'm going.
Yeah, man, that's actually such a good advice, though. I just feel like sometimes when you're that young, or if you don't have people around you to advise you, you don't realize how important that is, right? It's like, for me at least, I wish I could look back and realize, man, if I'm gonna, well, I didn't actually know for sure I wanted to go to medical school, but it's a little bit of a different story. But if you know for sure you want to go to medical school, it's going to be expensive. So if you can save yourself some money up front, that is such a good advice. So that's amazing of you doing that. So tell me a little bit about your pre-med experience. So for sure you're pre-med and you want to go to medical school. What was the grind like? How was it taking the MCAT and preparing for that for you to get you to that next level?
Yeah. So I was a little bit of a non-traditional pre-med student. I knew that I wanted to be a doctor, and I also had other interests. So I was initially going to be a dance major when I got to undergrad.
Nice.
But with the conflict of like all my pre-med prerequisites and dance, it was just a conflict. And so I had to kind of pick one. And at the time I was like, well, being a dancer is not going to pay my bills in the same way that being a doctor will. So fine, I'll, focus more on my pre-med stuff. But the classes were hard. Like, being a pre-med student in general is tough. I remember like my first general chemistry class, like I straight up failed the first exam. Like, and that was my first time in failing anything. And I was just like, oh my God, what do I clearly can't be a doctor if I can't even pass the first test of undergrad.
Yeah.
But it was okay, clearly here we are. Things worked out. But it was tough. And so I did all of my pre-med classes. I was actually an anthropology major because some of the classes overlap with my interest in like more social sciences and humanities, but then could also take like a health science or medical lens with those classes. Anthropology ended up being my major. Dance was my minor. And then I did all my pre-med classes. I actually didn't apply to med school right away. I knew I wanted some time off because, like I said, being pre-med was hard. I was tired. I was like, I'm just mentally not ready to dive into another 4 years of like intensive work and study. And so I joined Teach for America, and I did Teach for America for 2 years. I actually went back home to teach in like a neighborhood and community that I was familiar with, taught science. I did biology, anatomy and physiology, and I was the cheer coach. So I just had a nice little career as a teacher for a couple of years, and then applied to med school while I was teaching. I took the MCAT before I graduated from undergrad because I was like, I know being a teacher, like I'm probably not going to have time or energy to be able to, study for the MCAT and do well. And so I got it done like in the spring before I graduated. And so I think that's, kind of in all these steps, I've kind of been very forward thinking. And even if I don't have the answer right now, if I'm not doing the thing right now, I'm still thinking about how I'm going to make it there. And so I think had I not taken the MCAT before I graduated undergrad, I probably might have had even more challenges or more delay in getting back to med school. That's like the long version of the story.
What's your advice on, I guess, taking a break, like what you did? I feel like for me, I didn't take a break, so I went straight through, literally from back when middle school all the way to now. I've never taken any breaks, and I don't know. Looking back, I'm almost like, man, I think I should have, because
Yeah.
sometimes you feel that burnout a little bit, especially with surgical residency. And so, like, what's your take in that? And you did teach to America. What kind of things can people do? I guess so when they take that time off, it just doesn't look like, oh, they're tired, they want to take time off.
Yeah. I think the biggest thing, one, is just knowing yourself. I know myself very well, and I know that had I tried to go straight through, that would not have worked out for me. And I even remember in high school, I was telling my parents, like, oh, I'm going to do this combined degree program where I can get my bachelor's and my MD in 6 years. And now that I think about that, I'm like, I would have lost my mind. Like, that would not have been good for me. So, yeah, I think you have to really know yourself and recognize when you're hitting that wall of burnout, because it would have been more detrimental for me to try to push myself and go straight through and then get burned out, and then maybe I wouldn't, be where I am today, right? Because I'm getting tired at these other stages when the stakes are a little bit higher. And so I was just willing to take that risk. And, like, if people think it's weird that I was a teacher for 2 years, that's okay. We'll figure it out. But I'd rather, take that time for myself to recover and make sure that I'm certain that this is what I want to do. Because this is hard, right? Like, working 80 hours a week, surgical residency is not easy. And so for me, if there was any doubt or anything telling me that I needed to slow down first, I had to do that, because, it's a marathon, as people say, like, it's a marathon, not a sprint.
Hmm.
And so I had to make sure I had that endurance to be able to now make it through 8 straight years of training from med school to residency.
Yeah, yeah, I completely agree with you. And I feel like back then sometimes people viewed it as almost like a weakness or something not going through, but now I think everybody's realizing it's actually a strength in terms of, like, you slow down, you get to really contemplate and realize, okay, is this what I want to do with my life? You're more mature because you just finished college. Like, is this actually something you want to go through? And you can actually really learn about what it takes to go through medical school and residency and the delayed gratification that comes along with all that. So I think almost everybody that I talk to nowadays, to be honest, everybody's like, yep, I took a gap year. I took a gap year, which I think it's a good thing, because you don't want to go through this whole process and then you go to the other end, you realize, "Oh, I'm kind of maybe regretting doing this." So you
Yeah.
really gotta love what you're doing and know that it's not gonna be an easy path. So you're in finishing up MCATs. You became a teacher. That sounds actually like a lot of fun. And the cheerleader coach, even more fun. If I did that too, I would have been like a basketball coach or something. I think I would have enjoyed that,
Yeah.
or a soccer coach or something. But now you apply to medical school. How did you decide where to go to medical school? Were there factors? Undergrad, you said you just wanted to go somewhere that would give you some money. What were the factors for medical school?
Yeah, for med school, I think it was a little different. Like, I was prepared to take on some amount of loans at that point,
Hmm.
but I was also still selective about how much I wanted that to be. So, for example, I applied to schools all over the country. I applied in the South, I applied in the Northeast, in the Midwest, on the West Coast. And at the time, the school that I thought was my number one was USC in LA. Loved the school, loved the program, toured there, had a great time. And this was like when we were going there for interviews, right? So we're like traveling everywhere to go interview at these places. And I got accepted to USC, but they did not give me any scholarships. And at the time, the tuition was like $92,000 a year. And I was just like, absolutely not. I'm not finishing med school with over $400,000 in debt. Like, that's just not. And so I kind of pivoted a little bit and I was like, okay, well, my dream school is clearly no longer like on the table. So what am I going to do? At that time, I had already applied to Emory, to WashU, like to more places that were like a little bit closer to home and a little bit more affordable, but they're all private institutions. So they're all still expensive. At that point, I really started focusing on like what my experience would be like. Is it in a city that I can enjoy and have fun? I'd love to have a life and like spend time outside of my studies and making sure that I'm in a place where I can have fun, where, you know, there's people that I know that I like, that I can hang out with. I thought about what the community of patients would look like. So that was very important to me because everything that I've done as far as like pursuing this career has been for the good of people who look like me and people who come from communities like I do. So that was another thing. And then making sure that, you know, the OB-GYN program wherever I was going was strong. I knew I wanted to be a doctor and I knew I wanted to be an OB-GYN. There was a little bit of, you know, testing the waters later that we can talk about. But for the most part, I knew I wanted to be an OB-GYN. And I wanted to be in a city that allowed me to take care of folks that looked like me, especially in my like early medical school training phase. And really, Emory checks all of those boxes. I loved Emory as a med student. Even when I got there, I loved like how much they allowed med students to be involved in like curriculum development and really shaping the experience in the medical school. And so I did a lot of like curricular stuff there. I ran a student run clinic with a team of other med students. I had a great time. I loved Emory. I don't know. The patient care experience was great. I felt like as students, we had a lot of, you know, autonomy and responsibility, even though we're students, you know, appropriate level things. But yeah, I had a great time. I felt challenged. I don't know. I tell people all the time, going to Emory was a really good decision for med school.
Nice. That's amazing. And so you got into medical school. What you guys do, like a year and a half of essentially classwork and then clinical work?
Mm-hmm.
I
Yep.
think that's what I remember from memory. And
Yes.
then taking steps. And then you got
Mhm.
at what point, I guess, did you make that OBGYN decision? And yeah, let's start from there.
I came in very interested in OB-GYN.
Mm.
And when we did our third year rotations, OB-GYN was my very first rotation. And I was extremely nervous because I'm like, oh no, this is what I want to go into. It's my first time like being on the boards. Like I can't mess up. Like this has to be perfect. And I remember reaching out to some of the OB-GYN mentors that I had connected with and, you know, just like meeting with them and talking to them on the phone. Like, what do I need to do to make sure that, you know, I get like an A? Because we were graded. Like our clerkships had A, B, C, D letter grades plus minus. And I was like, I need an A plus in OB-GYN if I'm going to go into OB-GYN, which is a
Mm.
lot, but that's what I thought. And so they literally gave me a play by play like, okay, when you get there, this is what you do. This is how you can be helpful on your teams. This is how you can help the residents. Like, these are all the expectations.
Mm.
And it went great. Like I had a great time on OB-GYN. I was delivering babies with the residents late at night. Like it was everything that I thought it would be. And then as I like went throughout the year, there was a bunch of stuff in the middle that I was not interested in at all. And then my very last rotation, it was either last or second to last, was surgery. And I had a ball. Did trauma surgery at Grady. I did trauma, burns, vascular. I did the bariatric surgery service and acute care surgery at Emory Midtown. I had the time of my life. And I like had this moment of like, oh my God, am I about to switch specialties at the end of third year? Like, this is crazy.
Mm-hmm.
I was like this close to switching to gen surge and being a
Wow.
trauma surgeon. I absolutely loved it.
It's not too late. I'm just kidding.
No lie. There are still days where I'm like, dang, I know that I made the right decision at the end of the day. I made the right decision, but there are still moments where I'm like, wow, it'd be really cool to be a trauma surgeon right now. But yeah, I like looked into research projects in trauma surgery. I was talking to her, like, oh my God, I think I'm gonna switch. She's amazing. But at the end of the day, I was like, you know, I think I have spent so much of my life and like dedicating myself toward this passion of specifically women's health and reproductive health care. And that's not something I wouldn't feel complete if I gave that up. right? I love the adrenaline rush and the pace and everything of trauma surgery. But at the heart of what I'm interested in and why I'm interested, it's the things we talked about, right? Like to give back to people who look like me, especially Black women who are in these tough situations that we find ourselves in with reproductive health care. So I did I almost jumped ship and then I jumped back. And here we are.
Nice. So did you end up doing away rotations after that, or you were you
No.
COVID, or did you?
I was at like COVID border. So
I
like
see.
the first half of my fourth year was like full COVID, like everything shut down
Mm,
completely. But there were some people I think who were still doing aways here and there. Like it was very selective. But I decided I wasn't gonna do any. And that was really decided by my mentors for the most part because
mm-hmm,
I don't know. They gave me some really sound advice, I think, which is something that I pass on to a lot of students is if your record looks good, right? So like maybe this doesn't apply for other specialties because I think, certain specialties have to do aways. But for OB-GYN at the time, they were like, your scores, your evaluations, you look great on paper. You are a very competitive applicant on paper. Do you want to risk going to another institution where you don't know anybody, you don't know the system, you have to adapt for 4 straight weeks, and you have to perform at the top of your ability every single day, and any wrong move can ruin your chances of going to that institution? Or would you just rather let them see you on paper and think you're amazing? And I was like, yep, I'll take the second one.
yeah.
So I did no ways. I did no ways at all.
So if you even if COVID didn't happen, is that still your advice to anybody? Yeah. Okay.
It depends, right? Like, I
Yeah.
think
Yeah.
people have to really talk to their mentors, talk to
Mm,
people who know their application, and just get really personalized advice. And so, the personalized advice that they gave me was like, don't do it because you're going to take a risk. But I think, there are some students where it could be beneficial to,
mm-hmm,
go somewhere else and try to, learn their environment and learn how they do things. So,
mm-hmm.
everybody's different.
I completely agree. So for me, I went to Morehouse for medical school and I was interested in ENT, but we don't have an ENT department at my school. So
Mhm.
for me, again, the situation was different. It's like I have to kind of show why then are you interested in this field, right? It's like so I had to do away rotations and I had to kind of show that I'm interested in this field and actually get my name into all these different schools because I needed letters too. They can't just come
Mhm.
from my general surgeon, right? You need letters from like chairs and all those kind of people. So, but I completely agree with you because sometimes, I mean, by now you're a resident and you've had probably sub-Is in your program, and sometimes it's like somebody can be an amazing person, but they might rub off one person in the whole department, and that's it. Like their character or their rank already goes down just based on that. So I think it's so important to tread lightly, as you said. It's like talk to your mentors, talk to people who know you, and see what they think about your application. Would this actually help you, or would this actually maybe just put you down?
Mhm.
For some people I've heard they're saying, okay, if you're really interested in the place, maybe you should go. But then at the same time, I'm always like, if you're really interested in the place, maybe you shouldn't go because you don't, so it's like, I think it
Never
depends,
know.
right? Yeah. Like, and I think another thing, to be honest, when you do sub-Is, I realize you get better as time goes. So if you do more
Mhm.
than one, and maybe do the place that you really want to go to last. So by then you're like a superstar. You already know everything about the field. You know how to help people. You know how to be helpful, and you can actually really contribute, and people would love you that way. So I think that's another thing to
Yeah, that's a great
consider.
idea.
Yeah, yeah. Now that I'm looking back, I'm like, that's probably what I should do. Too late now. I'm just kidding. I'm
No,
pretty happy where I am.
it's fine. You did great. You
Anyway.
legit. It's fine.
So tell me about interviews. How many places did you interview and what were you looking for in that process?
Yeah, I think, a pretty successful interview season. Everybody is always trying to figure out, oh, how many what's the number of programs that I should apply to? At the time, I think there were 13 people in my class at Emory who applied to OB-GYN. So there were a lot of us. And so, a lot of us were probably interested in many of the same places too. And they're not going to interview all 13 people from Emory, right? And so A lot of the advice was to apply to a lot of programs, broaden your horizon. At the end of the day, I didn't have money for that because every application costs money. I think I applied to, it was either 35 or 40 programs. I can't remember the exact numbers now, but I received like 30 interview offers. And I think I scheduled 15, but by the time I did number 12, I was tired and I stopped. And then I ranked 12 places and I matched at my number one out here in California. So
Amazing. Congrats. That's a
again,
big
I
deal.
think people just have to really know themselves, know their application. And when you're looking for programs, like find places that align with your vision, right? I did a lot of research, I did a lot with medical education. And so, in talking to my mentors, they really cut a lot of places off my list because they were like, it doesn't make sense for you to apply to these community programs when you know you're interested in education, you know you're interested in research, take those off your
Mm,
list,
yeah.
right? And so I really appreciated, honesty from people around me to be like, no, you are a competitive applicant. You don't have to apply to so many places. You're going to get interview offers. Like, you'll be fine. So that was kind of how I approached it. Again, that everybody should tailor their approach to their situation. But for me, I didn't have enough money to apply to 100 programs. And I was just very selective. I definitely
Hmm.
had those like reach programs and those that I felt like were more comfortable and like, okay, I should definitely hopefully get an interview here. But yeah, that's kind of how my interview season went.
Nice. So tell me a little bit about, what are some of the challenges that you faced, throughout this journey, really up to that point? Were there any moments when you doubted yourself that you could do this? Were there moments when you're like, I kind of don't want to do this anymore. I'm tired. Tell me a little bit about those moments because, we all go through those times.
Absolutely. I don't know, there've been quite a few challenges on this journey. I think one of the biggest ones has been the fact that there wasn't really anybody close to me who I could, go to for help because nobody in my family had ever done this before, right? And I think that's one of the biggest differences with a lot of underrepresented minority students who are trying to get into medicine, right? Like, some of us have parents who are doctors, right? I personally don't, but some people do. But I think as far as the majority, we are doing this on our
Sick,
own
sick the
without
first
really
one.
a lot of guidance from anyone else. And so that was one of the biggest challenges I face is like, I'm going to be the first one and I got to figure this out because nobody else really knows what to tell me. And so I really overcame that by just not being shy about seeking out mentors. And if I met a Black woman who was an OB-GYN, I was going up to her, introducing myself and asking for her contact information. And
Nice.
so that's how I got like one of my first OB-GYN mentors at Emory. It was Dr. Cherie Hill. She's now the program director of the residency program there. But at the time, she was like junior faculty. She had just been at Emory for, I think, a couple of years. And she came to give a talk for us to SNMA. And after the talk, I went up to her and I was like, hello, I'm Chrissy. I'm interested in OB-GYN. I would love for you to be one of my mentors. And even to this day, almost 8 years later, like, she is one of my mentors. And like, when I was applying for jobs and trying to figure out what I was looking for in a career, if I wanted to do fellowship, she was one of the first people that I reached out to. And so
Mm,
I think finding and having mentors, having good mentors has always been one of the biggest challenges, but just using networking to be able to
yeah.
overcome that. Um,
Yeah.
I think another one is finances, right? My is not rich, we're not wealthy. They're doing okay, but they're not able to, just like throw money my way and support me and, do everything for me. And so that's been tough throughout this process. And I think that's another reason that I chose to do Teach for America and take some time off is because I worked, I had a regular job. I was able to save money to travel and go on trips, but also to be able to afford my med school applications. And so just always thinking of ways to plan ahead, right? Because I knew I was going to have med school debt. I don't want a ton of credit card debt too in affording these applications and other things. So, just figuring out ways to overcome the financial challenge that is applying to med school. There's like all the tests, all the books, the step
Mm-hmm.
exams,
Yeah,
and now like I just spent $1,700 to register for my board exam.
I know.
So it's like never ending
Yeah,
money. Like
I know.
just give me the
I
money, give
still
me
don't
the
know
money.
why. I still don't know why that stuff is so expensive, to be honest.
No, like where is that money
Where
going?
is it going? Like making a test does not cost that much money. Come on. Like, anyways.
Like,
But yeah, I mean, those are all very valid, to be honest. I think you're not alone on that, right? It's like I would echo the same thing. Being the first one in the family, it's like, I mean, I can't really, yeah, I can talk to my family about the struggle of
mhm,
residency or the struggle of medical school, but they don't know what that is. It's like when I tell somebody, yeah, I had to work that whole weekend, they're like, what do you mean you gotta work 72 hours? That
mhm.
makes no sense. I'm like,
Yeah.
yeah, that's kind of how life is. And so, yeah, I think that that part is, it's hard because it's like the people who you's gonna relate to, and now you can't kind of relate to with
Mhm.
a lot, and so and that's kind of why residency becomes such a big part of your family, if that makes sense. Like your co-residence just becomes, because you're going through the trenches with them. I think that's
Mhm.
one of those things I wanted to ask you. Like when you're picking a residency, what kind of vibes were you looking for? Were you trying to just be like, all right, this is, I want to do academia and this and this and this. What else did you look for that those programs?
Yeah. So, as we all know, the landscape of reproductive healthcare in the country has changed a lot. And that something that's very important to me is learning how to do my job to the fullest extent, right? Like, I don't ever want there to be any patient that I see that I'm like, I don't know what to do with, or that I feel like I don't have the basic skills to be able to manage. And so that was part of my reason for coming to the West Coast, specifically to California, is because I wanted full spectrum reproductive healthcare training. I also wanted a program where I would not be the only person that looked like me in my program, in my class. And there's so many OB-GYN programs where there's one Black resident per class or one Black resident in the whole program. And for me, that just wasn't acceptable, especially with the landscape of Black maternal health care in this country. I felt like I deserved to be somewhere where I was not the only one, and there would be other people who could relate to my experience, who I could go to and be friends with. And so I was looking for programs that mainly met those two criteria, right? Like full spectrum reproductive health care training and having really diverse residents. Ideally, I wanted to be in a city that, again, had the diverse patient population, similar to what I was looking for med school. San Francisco ended up being a little bit different than what I thought, but that's okay. But those were like my main three things. Again, being in a city where I felt like I could have fun, I could have a good time, even though I'm working 80 hours. Like when I am off, there's a lot for me to do. And, I can make friends that are outside of medicine too. So those were the main criteria for me.
Nice. So tell me a little bit, as far as, us being Black physicians, Black surgeons, everybody I've talked to on this podcast always has a story about just,
Mhm.
it's different. I can tell you a story like this past week. I was like going to consent a patient on the floor because I'm going to go to the OR with my team. And when I got there, a nurse next to me was like, oh, are you ready to go transport the patient to the OR? And I was like, no, like I'm wearing scrub, I have a surgical cap. Yeah, like you could at least ask.
Yeah.
I am one of the surgeon, residents, but there's a lot of those kind of situations, and sometimes, we're not treated as equally on some situations, and so I just wanted to ask you a little bit about your experiences, especially when you mentioned like I didn't want to be the token, essentially,
Mhm. Yeah, exactly.
And so, what kind of challenges or what kind of things have you faced, during maybe from medical school and maybe even during right now residency?
Yeah, for sure. I can remember a very specific story, which is during my intern year. I was a part of like a select group of residents who did something called centering pregnancy, which is like group prenatal care. And so we get assigned a group of patients. We followed them literally from the beginning to the end of their pregnancies. And I remember being on my GYN oncology rotation, which is a lot of time and time spent in the hospital. And I got a notification that one of my centering patients was downstairs on labor and delivery about to deliver. And so I like finish up my tasks really quickly and I run downstairs, deliver her baby. She's so excited because she didn't know if I was going to be able to be there. And it was great. And then I go back to doing my tasks. Well, the next day I go to visit the patient on postpartum just to, check in and continue that continuity of care. As I'm talking to the patient, her nurse walks in, completely interrupts our conversation, and stares at me and goes, "Who are you?" Mind you, this is like 8 months into my intern year. I am wearing hospital scrubs, my jacket with my program logo and my name on the sleeve, an ID badge that says doctor, right? And so I was just like, "What?" And she's like, "Who are you?" And I was like, "I'm Chrissy. I'm one of the residents." And she grabs my ID badge, which is like hanging around my neck on a lanyard. And she's like, "I don't know you. I don't know you. I've never seen you before." And I was just like, "Okay, let my badge go, first of all, because now this is assault. Like, you are touching something that's on my body." And I was just like, "I'm Chrissy. I'm one of the residents." And I just told my patient, like, "I'm so sorry. I will have to come back another time." I told that nurse, "Don't you ever touch me again." And I walked out and reported her. And I think it's one of those things similar to what you said, right? Like, people just don't expect us to be who we are. And for me, it was just very jarring because my program does a pretty good job of like printing out resident face sheets and like posting them all over labor and delivery, all over our units, so that people are supposed to know who the residents are. But for some reason, that lady just didn't believe I was this patient's doctor that day. Yeah, so that was a really tough moment for me as an intern, right? Like, I'm going out of my way. I'm not even assigned to the labor and delivery service right now. Like, I'm taking time out of what I'm already doing to provide a service to this patient, to be there for this patient, doing extra work. And here you are questioning who I am, why I'm in this room, and disrespecting me in front of a patient. And unfortunately, it's happened many times since then, in different variations. But it's sad. I mean, it's sad. It's part of our journey, but it's very, very sad.
How do you feel like, I don't know, part of me is like, it happens so many times sometimes that I'm like tired or fatigued, I guess. Is that what we call it? Like there's this like, I'm like, all right, it's fine. You confuse me again
Like,
with that person.
sensitized
Yeah,
almost.
it's like, should I spend my energy? But like, part of me also was just like, man, should I do more of, trying to educate people, not necessarily being confrontational or anything, but it's like I don't know, because I always try to see the best out of people, but at the same time, it's like, come on, we're in like 2025, like we can also be surgeons, we can also be OB-GYN surgeons, we can also be ENT surgeons, just because
Mhm.
you haven't seen one look this certain way, like we also can be here. Actually, funny story. Today, literally, I was in an elevator. I was wearing my white coat because I had clinic, and this lady, colored lady looked at my jacket and was like, "Whoa, you're an ENT resident?" And she was so happy. She was like,
Yes.
I haven't seen so many people who like you in this." I was like, "Yeah." She made my day, to be honest. It's like there are
Yeah.
also those moments which are really cool because it's like people are glad, they're not expecting it. I mean, sometimes you walk in a room and people are not expecting to see people who look like us doing the work, being this smart and grinding and getting the scholarships like you're getting, and like and you
I
know
mean, that's the best part, right? Like, that's why we did this. There's so many times where I like walk into a patient's room and it can be a black patient. This literally happened 2 days ago. I walk in the room, it was an older black woman, and she looks and I was like, "Hi, I'm Dr. Freeman." And I just saw her like relax. Like, she just looked so comfortable. Like, we just talked through everything that had been going on with her care and like made a whole new treatment plan. And she was just like, "Thank you so much. I'm so glad you're here." Right? And it's just like those are the moments that make it all worth it, right? Like, from the beginning, like, this is why I wanted to do this, and to get those, we don't need validation, but to get those small nuggets of validation, especially from patients, ugh, that's the best.
yeah, yeah, you're right. And like, I mean, those are the things that get push you forward too, right? It's like when you're reminded them like, man, I wanted to do this because of this, and you're seeing that in your patients, and you're seeing them relax, seeing that trust,
Mhm.
and that's what it's all about. It's about the trust, because you can treat the patient however you want, or you can be like, oh, this is what you have, I'm going to give you this medication. If they go home and they're not trusting you, your judgment, then you haven't really done much, right? So I think that's why we need more people like us in these fields, because we need
Agreed.
patients to trust their physicians. I'm not saying that other
Mhm.
people cannot, but it's like there's that relatableness part of
Exactly.
medicine and the practice of medicine. So, now you're finishing up residency, you're about to be an attending. That's
Mhm.
amazing. Tell me a little bit about, you talked about you wanted to do something academics, you
Mhm.
like to teach. What was your decision about that and versus going into a private practice? And, educate us a little bit about how you found your job and negotiated a little bit.
Yeah. So I have I did teach for America in between undergrad and med school. And I remember my family was like, why are you doing that? Like, how is that going to help you as you become a doctor? And I think for me, academic medicine has been exactly that, right? Like, it just makes sense. Like, all the skills that I learned as a teacher, I taught high school students. So, they have a little bit of higher level brain function. And then I apply that to, teaching my junior residents or even educating my patients sometimes. And so for me, I knew that I wanted to stay in academic medicine. I considered the private practice route, but in my experience in my interviews, it seemed like there was a little bit less direct like support and mentorship as like a junior person joining the practice versus being in an academic institution where there's like junior faculty, senior faculty, there's other like residents that you can be involved with, there's medical students, like there's just so many layers of support. And so I wanted to be in a place where I could have that. OB-GYN is, I tell people all the time, it's a really tough field. Like it's one of the few fields of medicine where you're doing like a lot of outpatient work, a lot of surgery. Labor and delivery is its own entity. It's like an emergency room
Mhm.
almost, but also like inpatient management. It's OB-GYN is hard. Like there's a lot of depth and breadth of information. And so I didn't feel like I just wanted to be like, okay, there you go, you're on your own. Definitely wanted to still have that support system kind of built in, even though it's different than residency, right? So that's why I chose to stay academic. I wanted to, still have the opportunity to teach and mentor students or residents. And yeah, I don't know. I really like teaching. I got a teaching award this year. So I think I'm,
Nice.
like I
Congratulations.
just let that go. I can't let
Yeah,
it go.
yeah.
A teacher at heart.
That's amazing. Did you look at any other academic institution, or you knew what you wanted to come back to Emory?
I knew, yeah, I was very interested in coming back. I've been like talking to my mentors at Emory literally all through residency. I looked at other institutions. I really love the city of Chicago, so I was really trying to go to Chicago.
Hmm.
But ended up going back to Atlanta. And for me, I needed that familiarity again, right? Like, of course, it's going to be different because the last time I was there, I was a medical student, and now I'm going to be there as an attending. But just having that familiarity with the institution, still having some of my same mentors when I was a med student who are there now, people who are excited to have me and are welcoming me with open arms, and just having that kind of like warm welcome. Like it feels like, okay, come, yeah, you went away, you did your thing, now come back home.
Yeah,
That's kind of how it feels. Every institution has its challenges, right? So I know it probably won't be a perfect situation, but I'm just excited to kind of start over, replant my roots in Atlanta and, go from there. See what's on the other side of this.
yeah. Well, congratulations on that.
Thank
Before
you.
we finish this up, just want to ask you a couple questions. If you had to give advice to maybe like a high schooler or a pre-med student, what advice would you have for them as far as, if they wanted to become an OB-GYN?
Yeah, that's really good. I think I would say make sure that you're certain because again, like this is a very tough field to be in, especially now with like the political landscape of our country and every like being an OB-GYN is hard right now. And there are so many other ways that you can contribute to women's health, reproductive health without being an OB-GYN. And so I just tell people like, make sure that the clinical side and the clinical practice of being an OB-GYN is something that you're interested in. Like my little cousin thought she wanted to be an OB-GYN. And after I kind of like talked to her about the expectations and like what this is really like, what residency is like, she chose to be a midwife. And so now she's a midwife. She's thriving. She's doing amazing and still doing some of the similar work. Right. And so anytime I meet younger students who are interested in medicine, I just say, make sure you're exposing yourself to everything. Being a doctor is not the only career in medicine, right? Like you can be a nurse practitioner, you can be a PA, you can be a midwife. Like there's so many opportunities and ways to be involved in healthcare. And so I just say, like, try to expose yourself to everything to be
Nice.
sure. Because this is a lot, right? Like this whole journey, like 12 years of dedication to one goal, like 12 years minimum, hundreds of thousands of dollars in debt, right? Like this is a huge sacrifice. And yeah, I just, you can't do this for anybody else. Like you can't do it because your parents want you to. You can't do it because you think it's cool. Like you have to want it for yourself. Like all the blood, sweat, and tears that this takes to get done, like you have to want it for yourself.
Nice. That's a really good advice. Now, what if it's a medical student who is already there? Now they're picking between ENT and OB-GYN, which they're very different. What would you tell them? Why should they pick OB-GYN?
Because it's the best. It's the best. As for all the reasons that OB-GYN is challenging. So all of the different layers of patient care that we're involved in, like sometimes you are essentially doing a primary care visit, and then sometimes you're referring somebody to a subspecialist or booking them for surgery and like all these things. For all the reasons that it's hard, those are all the same reasons that it's incredible. And I love that every day of my life can look completely different. And maybe that's not the thing for some people, but it is for me, right? Like some days I can be in clinic. Some days I can just be doing regular GYN clinic. Some days I can do prenatal clinic. Some days I have procedures in the office. Some days I'm in the OR. Some days I'm on labor and delivery. And even on labor and delivery, like the broad range of experiences that you can have are so different. And so again, that's why it's hard, because we have a lot to learn in this very short 4 years of OB-GYN residency training, but that's why it's fun.
Love it. Well, thank you so much for taking the time and talking to me about your journey and your life and why OB-GYN is so much better than ENT, I guess. I'm just kidding.
It is.
I really appreciate it. Just I can sense your passion for women's health, just especially minority women. And I'm really excited to see what you're going to do in the future and how much you're going to impact. I just know you're going to be a superstar already. So I
Well,
can't wait
thank
to
you. I
see that.
appreciate that.
Emory is going to have an amazing, amazing, amazing person coming in. So that makes me really proud.
Aw, thank you so much.